Hey everyone, it's Dr. Lauren. Welcome to this episode. So today, this episode, I don't have a lot of time and because the baby is sleeping, so I use this time to record this episode that I've been working on all week. But today I want to talk about my fertility story. If you follow me on Instagram, which you should all be following me on Instagram at Dr. Lauren Powell, you know that I have a baby and that I went through IVF. I didn't share I went through IVF until after I announced that I was pregnant. So there's just a lot that goes with IVF. And so I thought that I could just take this episode and just tell you like my entire journey and show you lab work, show you just everything that went along with it. Now, I want to kind of give this disclaimer. Everybody's journey is different. And my reason for having to do certain things may be different from somebody else's. And so some medications may be appropriate for me that are not appropriate for somebody else. And just because this protocol works for me doesn't guarantee that it's going to work for somebody else. There's a lot that goes into that. So my objective in sharing this is just to share my story so you kind of have an understanding of what the process is like, because I knew nothing. I just kind of learned as I went along. And even as a medical professional, we don't learn about this stuff. Unless you're going to be actually doing it, you don't learn about this stuff. So I was literally learning as I went along and trying to research. So I want you just to have an idea of like, what is IVF, what goes into it, and just to give you an idea, if it's something that maybe is going to be a part of your journey, or maybe if you have a friend or family member that they're going through it, you could kind of have an understanding of what they're going through and what that process is so you can best support them. Okay, so bear with me. I have notes because I don't want to miss anything because there's a lot. And if I left it up to my head, I probably would not remember all the details. So that, and then you're going to have some pictures and things that get flashed through the screen. Okay, so I'm going to go through my story. Then I'm going to talk about what kind of things just to expect in general when doing IVF. And then I want to answer some of your questions that were submitted. Now, I have to be honest in that the question box disappeared before I was able to get all the questions that y'all submitted, but I got a good number. And I'm hoping that by sharing my story that it answers some of your questions as well. Okay, so just at first, I'm just going to go through it in chronological time. So I had my copper IUD removed in January of 2019. Now, those of you who know, copper IUDs have no hormones, right? They're copper, they're made out of copper, and the copper acts as a spermicide. That's how it prevents pregnancy. So what that means is, I never stopped having my periods because it's a non-hormonal form of birth control, which I wanted. I don't do the best with hormones. And so I was having regular periods. So in my mind, when I removed my IUD, I thought that I would get pregnant pretty quickly. I wasn't necessarily like trying to match up dates and do all that stuff. I just said, I'm going to get my IUD removed. My husband and I talked about it, and then we were just going to see. Now, I'd say by around, I didn't say what month I started this, but maybe around the fall time, I hadn't got pregnant yet. And so, and by that time, I was kind of planning and like tracking my cycle, doing ovulation, peeing on sticks, and kind of just doing all the things to kind of track. And it wasn't working. So I was like, okay, well, let me just go see my OB and make sure everything is okay. So I go to see my OBGYN. Now, general OB visit, this is covered by your insurance. I was having my annual pap smear. And I said, hey, I haven't gotten pregnant. At that point, I was 34. At that point, I was 34. What was I, 35? 2019, 34. I was 34. So, in general, we give women a year of trying before we do stuff. But if they're in their 30s, closer to 35, we just, by 6 months, we just kind of start the workup. So anyway, she said, okay, we'll do the basic workup. The basic workup also included what's called a FemViews, and that's just an ultrasound, HSG, or hysteroscopy is another word for it, but another type of test that does a similar thing. Basically, it's just testing the patency of my fallopian tubes and making sure there's no scarring and everything is nice and open. So all of that stuff was covered by my insurance, okay? Because was with my OB, and it was just like a basic general workup. So did my annual visit, did some basic blood work. I don't remember all the stuff she tested, but I'm sure it was like my thyroid, basic hormone levels, I'm sure. And then we did the ultrasound to kind of just make sure all of my fallopian tubes and everything was open. We did an AMH, and that's probably it. So in general, my workup was normal. So she's like, okay, it's time for you to just go see REI, reproductive endocrinologist, so fertility specialist. So I said, okay. I went and saw someone. So at that time, my OB also gave me a lab slip where I could have a semen analysis. But for whatever reason, we didn't do that. I think my husband was like, well, just, do your workup and then we'll kind of see. So I was like, okay. So I went to a REI doc with a big health system that was recommended by a friend of mine who didn't do IVF, but had did some like initial like fertility stuff and just felt like she had a good experience. And what she liked about them is that they gave her like a price sheet when she walked, like for her initial consultation. They just gave her a price sheet. So she liked that it was very clear how much everything costs. And so I was like, okay. So I went and saw them and, had a great introductory virtual visit with the fertility doc and sent her over my blood work that I had done. And I think at that point, she didn't really need any additional blood work. She offered me what's called an IUI, so an intrauterine insemination. And so that's basically when the sperm is injected into the uterus right around the time that ovulation would happen. And so it's basically timing things like precisely. And so you can do this with like a natural cycle or a medicated cycle. So we did mine with a medicated cycle, meaning we use medications to time things exactly, and ultrasounds in order to plan when to do the actual procedure, if you want to call it. It's basically very like a long tube goes into your vagina, you don't feel it, they release the sperm and that's it. And then you see if you get your period or not the next month. So at that point we had done a semen analysis. And so my husband's sperm count was low. And so what we were able to do is called batches sperm. So meaning he would leave sperm, they would analyze it, they would freeze it. And then on the day of, he would leave fresh sperm. They would unthaw the frozen sperm, put those two together, and then do that IUI. The thought being is naturally, just like in general in life, when you conceive naturally, you lose a lot of sperm in your vagina. Mind you, the sperm has to make it through your cervix and travel up your uterus to your fallopian tube. So a lot of sperm gets lost in the vagina. And so the thought is that if your count is already kind of low, batching it and getting more sperm and then putting it directly in the uterus kind of increases the chances of the sperm making it to the egg. Now, with IUIs, so she offered me initially, let me back up. She offered me an IUI, or she said we can just go straight to IVF. Now, an IUI, I don't have this, I don't have the paperwork from that doctors anymore, but I think it was like $500 for an IUI versus like IVF. I don't remember again how much theirs was, but it was like a significant difference, right? Like maybe $15,000. So in my mind, I'm like, well, I'll just do the IUI because that, that could work. And she did tell me, now, listen, on average, it takes people 3 IUIs to make it work. It takes 3 IUIs. So I was like, okay. So we did the first one, not pregnant. So then I did the second one. The second one was in October. So August. So September. So the first one was in September. Now times are coming to me. First one was in September. The second one was in October. We did the exact same thing. Now, the second time we did the same thing in terms of batching the sperm and all that, but the number was still low. So I was really confused at this time. I was really confused. And I remember being there, I had my feet up in the stirrups. They want you to come with a full bladder because your full bladder causes your uterus to tilt some, and it makes it a little bit easy, like just helps with, inserting the probe and getting just better position. So I remember being like being in the stirrups, and then the doc was like, we were trying to figure out if she had all the sperm. And I was like, but why is the count so low if we have two samples, like a frozen one and then this fresh one? And so she was like kind of confused. And so she kept going back to the path lab. And what I didn't understand at the time that I later learned by just doing my own research is that when you freeze sperm and then you unthaw it, you lose like half of it in that whole preservation unthawing process. So you're going to expect the number to go down anyway. So batching it is good, but it's only going to help you to a certain extent because you're going to lose like half of it. So I didn't know that. She didn't explain it to me either. So the count was low when we went to do it the second time. And so she says to me with my feet in the stirrups, like, do you want to still do it? Because this is what the final count is. the chances of it being successful are kind of low, but again, you only need one swimmer to make it. So do you want to do it? And at that point I was like, again, my feet were in the stirrups, my bladder was full. I already paid for it, even though I'm sure they'd give my money back. But I was like, yeah, just do it. Like, I'm here, let's just do it and see. So that was in October. So then I really thought that it worked in October because I started feeling different and I really believed that I was probably pregnant. And then I wasn't pregnant. So then my period came, obviously I wasn't pregnant. So that by this time it's November, and during this time you do all the things in preparing your body for pregnancy. You're not drinking, I was drinking decaf. I was just doing all this stuff because there's only so many things you can control. So I was doing all the things I can control to what I thought would increase my chances of becoming pregnant. And so then it didn't work. And so at that point it was really, I don't want to say devastating, but I was just really disappointed because I thought for sure this time it worked. Like, I really believed, I don't know what it was, but I just believed at that time that I was going to be pregnant, and then I wasn't. The doc sent me a message via her nurse saying, it didn't work. Well, basically I emailed them and said, I got my period. And so then they messaged me back saying, the doc wants to set up another appointment and for you guys to go ahead and just get started with IVF. Now, let me say this. There's different doctors for different people. I'm not for everybody. I'm not for everybody. Even though I'm a great doctor, I'm not for everybody. And so I'm not wanting to discount this person at all, but it wasn't for me. First of all, the doc that I had my consultation with was not the one that did my IUI, which is like the whole thing, right? Like, that's like the whole process. And so not only did she not communicate that to me in advance, it was just kind of this thing where she just wasn't there that day. She wasn't there the next time I did another IUI, and then, never reached out to me when it didn't work. So I was just like, for the next message to be just like, she wants to get you enrolled in the next group, because I think they do like an orientation with a group of probably people at the same time to do IVF. And at that point I was just like, no, I'm just going to give it a break. It was going into holidays. November is Thanksgiving. November is my birthday. I was turning 35, Christmas. Yeah. And I'm trying to think, were we in the pandemic at this point? We were in the pandemic. Yeah. So everything was right. This is why my husband, he had to give his semen samples. He had to collect them at home and drop them off because they weren't allowing people in the clinic and in the hospital. So I just didn't feel good about moving forward with the whole situation. So I was like, I'm just gonna take a break. I'm gonna take a break. It's a holiday. I'm gonna enjoy the holiday. I want to drink, and I'm just gonna like wait and see. So then, I told my husband I'm just gonna wait, which he was, I think, relieved, because it was a stressful thing, right? And as the men, they can only control so much, and so they're just like, they see you upset and overwhelmed, they don't know what to do. So he was like, okay, yeah, let's just stop. So let me see if I know this date. Okay, this was in February. Okay, so sometime in January, I see a patient in my own clinic, and she tells me about going through IVF randomly. I don't know how we started talking about it. And she told me about the doctor that she was seeing that she loved. She was like, she's great, blah, blah, blah. I was like, okay. And so I was like, well, I'll call her and see if I can get an appointment. So mind you guys, the IUI and all that stuff I did with this other health system was completely out of pocket. And so I know no matter what, you should get good care, no matter what, no matter how things are getting paid. But that was another thing. Like, I was paying for everything out of pocket, and I just expected just a different level of communication. I don't know. So then I called this other doctor and attempt to make a visit, and she's booked for like 3 months. So I was just like, okay, whatever. Like, I guess I won't do it. I started then looking for other doctors that may take my insurance, but my insurance had no fertility coverage. So it wasn't going to happen anyway, but I still was like, trying. I don't know. I was trying to look for somebody who was in my health system because I thought maybe even if the fertility stuff wasn't covered, that like some stuff would be covered if I do it at my institution, like the ultrasounds or, like some of that, like I thought maybe I could get my imaging done. I don't know. Those are my thoughts. I was just trying to see how I could potentially do this in a more financial way that could make it work for us. So while I'm on the phone with the lady from the other office, she tells me, oh, there's a wait, you won't be seen for 3 months or whatever. And I was just like, oh, forget it, never mind. And then she's like, oh, wait, somebody just canceled. Do you want to come in on Friday? I was like, okay, yeah, do that. So I had a virtual visit with this new doctor. I'll say her name, Dr. McCarthy Keith. She knows that I talk about her often. I love her. So anyway, my husband and I had a virtual visit with her, and I sent over all my medical records beforehand. I sent over my husband's stuff beforehand. She reviewed that. And so her conclusion was basically that, she felt that there were a few things that could have been done to just optimize my chances of the IUI being successful. But she thought likely, IVF would probably be the best option for me at that point. But she offered me, she's like, do you want to do another IUI or do you want to go straight to IVF? And at that point I had done 2 IUIs, that takes time and money. And so I just was ready to just go straight to IVF. Another reason why I decided to just go straight to IVF, because I thought if I want to have kids, like I don't want to have to do this every single time. Like if I did IVF, I could get potentially, multiple embryos and not have to do this whole IUI thing every time I want to have a kid. Okay. So I decided to move forward with IVF. And so we first, she wanted to get some fresh labs. So I'll put that screen up. Let's see, so I can just look at them with you. So, and a lot of these labs, honestly, I had already had before, but at that point it had been a couple of months. She just wanted to repeat them. So vitamin D, checking for hepatitis B and hepatitis C. What else did we do? Syphilis, AMH, thyroid, CBC. And you want your AMH, you want it to be greater than 1. Mine was like just barely over 1. So, and it declines with age 35, it being, a significant change that is completely normal. Yeah, so those are just the baseline labs that we did, basically repeating the labs I'd already done, but fresh labs. She also suggested at that time that I do a male infertility, have my husband see a male infertility urologist. And I thought to myself, so that was offered initially with my first institution. And I was like, but why? What can they do? Right? If you have a low sperm count, a lot of times the reasons are just unknown. But I was like, and I was legit asking, like, but what will they do? Like, they'll do a workup, but then there's nothing you can do to fix it. So what's the point? And I remember it was the fellow I was asking, because she was the one who was telling me that. And she was like, I mean, nothing really. So I'm just like, I didn't understand it, like, make it make sense to me, make me understand why I'm spending more money, which I'm willing to do, if it's going to change something. Like, does it change something? Does it make, is there, and again, no one's fault, but I think because like it wasn't explained to me, I just didn't really pursue it. Anyway, when I saw Dr. MK, she suggested it as well. She suggested a specific urologist. I called that urologist to see if they took my insurance, because at this point, the urological workup should have been covered by my insurance. So I called, they said they took our insurance. My husband got there and then they're like, oh, sorry, we don't take your insurance. So then anyway, I ended up calling a friend of mine who was a urologist, and I was like, can you just see my husband and do whatever the infertility workup is? And he's like, of course. So of course my insurance covered that because he was within our hospital system. And I don't have my husband's paperwork, so I don't know all the stuff that they did, but I know they checked like hormone levels and some other things, and everything was basically normal. His estrogen was just a little bit elevated. And at that time he was a little bit overweight. Mind you guys, this is like peak pandemic. So he was a little bit overweight. And so you can see that because, our fat cells release estrogen. So if you have more adiposity, your estrogen levels can be higher. So that's what we, attributed to. We didn't think he had some like estrogen producing tumor or anything like that. It wasn't, his levels were not that significant. So the next part was to decide which package I was going to go to. So I'm going to show you that picture, which shows you the prices and just how it's broken down. So first I want to explain this. When it comes to IVF, I think about it in like two parts. The first part to IVF is making eggs. Okay, the first part is like making the eggs. Then you fertilize the eggs, they become embryos, do testing on the embryos to make sure that they're genetically normal, because that increases your chances of them sticking. And then that embryo has to be implanted inside of you and it has to stick. And then you have to wait and see if you're pregnant, because if it sticks and it continues to grow, that's a positive pregnancy. So like two things, I always think of IVF in like two ways: making the eggs and then implanting the embryo. So in this graph, you kind of see the different packages for IVF. So the first one was basically $10,000, and that gives you basically one cycle of IVF with one transfer, I believe. Yeah, with a fresh embryo transfer. So that means with a fresh embryo transfer, one cycle. And then the multi-cycle discount program was you could get up to 2 cycles of IVF and then unlimited frozen embryo transfer. So what does that mean? You could do a cycle of IVF and get no eggs. And then what? Or you can get a cycle, you can do a cycle of IVF, do genetic testing, or not even get to, but, or, you know, none of them fertilize, or none of them develop to the blastocyst stage, or, you know, they just don't, they're not viable. And so then what? You've done a whole thing. And so this is allowing you to do IVF up to 2 times in the hopes of getting eggs. Okay. And then you could unlimited frozen embryo transfer. So meaning you could continue to transfer embryos until one sticks. So if you know, do one, it doesn't stick, then, but you have like 5 frozen because you were able to get, you know, those from the cycles of IVF, then you can continue to transfer an embryo until one sticks. Okay, hope that makes sense. And then the third option was basically this option that gave you a money back guarantee, meaning you can have up to 6 cycles of IVF. So six opportunities to make eggs with unlimited transfers of embryos until you get pregnant. And they're saying that if, you know, they can't get you pregnant basically after 6 rounds, then you can get all your money back. Also in this option though, you could stop, like maybe after you did 2 or 3, maybe if you did 2 or 3, you're like, okay, I'm done. I just like don't want to do any more cycles. They'll give you your money back then too. As you can see, you have to be under the age of 40 and under. And then the cost of it changes with age. So between 35, 37, it's 22,000. And then if you're over 37, if you're 38, it's 28,000. So things that were in addition to that cost are the genetic testing, which was like $6,000. You can see that at the bottom. And then the monthly storage free. So usually most of these packages is covered for the year. And then after that is $50 a month. Now, so I chose option 2, the multi-cycle discount program. And I thought about choosing the option 3, which is the shared risk 100% refund, because it's not significantly more for my age. I was 35 at the time. Remember, I had just turned 35. And so the difference in cost would have been like $4,000, which is not significant when you're paying like 20. Right. But in my mind, I just didn't really think I needed, you know, I didn't feel like I was going to need a bunch of cycles. That was just something in my spirit that I felt, I think because we were dealing with more of a male factor, that I would be able to make eggs. Also, after talking to my friend who's an OBGYN, Dr. Jessica Shepard, love you, okay. She also recommended like that would be the second option would be the best for me. And so I was happy with that. So that meant I could get up to 2 rounds of IVF and then unlimited transfers until I got pregnant. Okay. So once I decided which program I wanted and I let them know, they would not start and you cannot do anything until they get all their money in full. And maybe that sounds like no duh, but I really felt like, oh, maybe I just pay a deposit and then pay the rest later. But it was like, no, we don't move forward. We don't send you any welcome to IVF information until your bill is paid. So I had to pay all that just straight out of pocket. So we did that. And then I was kind of approved. And so then we went with, I'll show you calendar 1. And this is just kind of how things started. So this started in February is when I started. So you basically start on birth control to kind of just like suppress ovulation and all that stuff. And we did that for 2 weeks. Then we got a baseline ultrasound. And then we started all the medications and injections. All the medications, that total cost I think was like $6,000. And that was from a pharmacy out of state. It was like this pharmacy in Tennessee that they referred me to, which gives like discounted fertility medications. So, and it was great because like you get them pretty quick, comes in like a big box and everything's frozen and, kept refrigerated. Things are supposed to be kept refrigerated. The only thing that was rough is because I don't know if you guys remember, there was like a big snowstorm that happened in Tennessee. And, those southern states, they are not built for the snow. So it like shut everything down. And so I remember I needed my medication, like I needed a refill on something. And because they had snowed in, it was just like a whole ordeal. But I was able to get some medications locally just as an emergency type thing. They were way more expensive, but I was able to like not have an interruption. Okay. So, okay, now let me give you guys the breakdown. So you see the calendar, and basically on that Friday, March 5th, and when we do blood work and ultrasound, basically do that every day until it's time for you to trigger. So you basically do that until your eggs in your ovaries, you're doing an ultrasound, and you want the eggs in your ovaries to be between 17 to 18 millimeters. And when that is about time, because that's, it's trying to mimic natural ovulation, that's around the time that your, the follicle would release the egg. So at that point, you would take what's called a trigger medication, and that basically tells those eggs to go ahead and go into meiosis, which is like this, reproductive cell division to kind of start maturing. So let me just give you like the breakdown of how things work. So I had, on the day that I did my egg retrieval, I think we had 17 eggs obtained. Okay. And then we fertilized them via ICSI. ICSI means you take one sperm and you fertilize one egg. So you do them individually. And that happens, we do this when you have, a lower sperm count, because you're doing 1-to-1. And so there's no concern about, that egg getting fertilized with the sperm, because you were like precisely doing individual sperm to egg. And so ICSI, with ICSI, you get about 80% of the eggs obtained should get fertilized. So I started with 17 eggs. I think it was 17 now. And then 11 fertilized via ICSI. And then out of the 11, 7 of them developed into blastocysts. So they have to develop, they have to grow to like the 6-cell stage. I think the blastocyst is like 6 cells. Okay. And so usually 30 to 50% of fertilized embryos developed into the blastocyst, 30 to 50%. So that's where we're at. I had 7. So the mature ones, then you could send off to testing just to make sure they're genetically normal, because that increases your chances of them sticking. Remember, many miscarriages that happen in the first trimester due to a genetic abnormality. So this is kind of helping negate that. So you have 7 blastocysts. We did genetic testing. 4 of them were abnormal, and then 3 were normal, right? Yeah, 3 were normal. So I was really glad that I did the testing, because again, I had 4 abnormal and 3 normal. Okay, so then I had 3 normal embryos. So now I can take you to calendar 2, and this is us preparing for the embryo transfer. So again, we were on birth control for 2 weeks, and then we expected to get a cycle, baseline ultrasound to see how the uterus is looking. Then we're on estrase for a couple of days. I think my levels kind of were low, and so I ended up increasing my estrase to take it not just 3 times a day by mouth, but then I also took it twice a day by vagina. And then once my lining got to a certain thickness, that's when we, and my estrogen was at a certain level, then we would start the, then they planned for the embryo transfer. And then I was also started on progesterone on the 22nd, and then the transfer, I think, was on, I don't think it happened on the 4th. It says on the 4th on the calendar, but I think it happened a couple of days after that because of just low estrogen levels. So the frozen embryo was transferred. I continued my estrogen and progesterone, and then you have to wait 2 weeks, which is like so hard because you're just waiting. You're wondering if you're pregnant or not, and they tell you not to take a home pregnancy test, which I did not do because I did it with the IUI, y'all. Was it with the IUI? Yeah, I took a pregnancy test with the IUI, and I had a positive test. I thought I was pregnant, and then it was a false positive because it was because of the medications that were in my system. So biggest disappointment, and I didn't want to have that again. So I did not take the pregnancy test. So I went into the office the day I was supposed to, took a blood test, and then they called me later to tell me that my test was positive. I went to the office in 48 hours to make sure the level doubled. And then I just kind of was under monitoring with ultrasounds and blood tests until 9 weeks. And then I was released from my fertility doctor to my OBGYN. I continued the estrace by mouth and vagina and the intramuscular progesterone. I continued that up until 10 weeks. So I was like taking all those medications up until 10 weeks. So that's it. So that's kind of like the whole story. I'll just stop it there in terms of, because this is just focusing on fertility part. I'm going to save like my pregnancy and stuff for another episode, but I'm doing good on time. Okay. What I wanted to do is just a couple of things to expect when you're doing IVF, just random things to expect. Expect frequent random appointments. They're just random because everything is based on like your blood work and your ultrasound. So they may be like, oh, can you come in tomorrow to do this ultrasound? And maybe on a random Sunday or Saturday, and maybe on a weekday. And so I was in a job transition, or I was going to be in a job transition. I had given my notice. By the time I had decided to do IVF. And so I was really hoping that I would get pregnant before starting my new job, because I didn't want to start my new job. First of all, my new job was a locums gig, so it was kind of far away. And that was going to be really hard for me to make it to appointments when my gig was like 90 minutes away, and I stayed there for the 3 days that I worked. So it was just going to be tough. So I was just know that you want to be in a position where you can leave work or leave what you're doing in the middle of the day if you have to. Fertility clinics are open 7 days a week because they know like stuff is timed, right? And so, but they're not open all night. So you still have to be able to go sometimes in the middle of the day. So frequent appointments, frequent random appointments. Expect lots of ultrasounds. Just expect to be naked all the time and people to just get comfortable with that. Possibly still being alone. I had to do all my stuff alone because it was COVID, my egg retrievals, everything just by myself. Even when, everything was by myself. Like my husband could wait because some stuff I couldn't, after the egg retrieval, they don't let you drive because it's under some anesthesia. And so my husband couldn't come in. He literally just had to wait in the parking lot, and then they rolled me out to him. It's wild. He was allowed to come to the very last appointment where we just did an ultrasound to just make sure everything was good. The cost, it's just expensive. There is financial assistance available. I didn't qualify for anything because it's kind of like I was in that position where I need it, but then on paper, it's like I financially make too much money to get help. So I also just wanted to mention, one of the things that I really wanted to do while I was going through this process that I felt I wanted to be able to do is I was praying that I just made so many embryos so that I could donate some, because you realize just going through this, how rough it can be for someone who can't make embryos, or someone who doesn't have access to someone with sperm to, be able to create an embryo. And so, especially as a minority, there's some states I was reading about, like this part of Michigan, that a Black woman could not find any Black female egg donors, none. And I just thought that was so like sad. So consider just something to think about, because I know friends who didn't end up using their eggs or embryos and didn't donate them and things like that, just because for whatever personal reasons. And I just think like if you can, it would just be a blessing to other people. Okay, some questions that you guys ask is what to look for in a doctor. I would say you want someone that you feel comfortable with. This is a very intimate thing. It's a very emotional thing. It can be this up and down roller coaster of successful, unsuccessful, successful thing. And so you just want someone that you feel comfortable with. I think that's the biggest thing. Someone you feel comfortable with, someone that you trust. And then the other question with that is, how do we know if we should get a second opinion if you don't feel that, if you don't feel like you're getting what you need, if you don't, yeah, if you just, it just doesn't feel right. If you feel like you should be getting more, then get a second opinion, and it doesn't hurt. You can always go back to the first one. I know people who have gotten second opinions, started something with the second doctor, and then realized that they really liked the first doctor. And you can do that. Like we're normal, we're human beings, and we have the right to change our mind and then change our mind again. Somebody asked what vitamins or supplements did I take. At that point, I was taking the bento supplements. So I was doing vitamin D, my prenatal, of course, fish oil, and a probiotic. Did I do acupuncture? I'll show this video. Yes, I did acupuncture throughout the entire time that I did IVF. And then I did like a special acupuncture session on the day of transfer, the day after embryo transfer. There's been benefits. There's been some data to support acupuncture. If anything, I felt like it was very relaxing. I mean, I would have the best sleep. And so if anything, I think it's good to just keep your stress level down. Somebody asked if I had endometriosis or fibroids. I don't have endometriosis. I did have a small fibroid. It was discovered during this process, but like it was very small and incidental and likely not having an impact on me doing IVF. I mean, I don't even think they mentioned it because they were like, it's so small and not even worth mentioning. Somebody asked, is there a BMI requirement? And so I just kind of looked and saw if there was one. And so basically the data states that the ideal BMI for getting pregnant naturally or via IVF is between 19 to 25. And they say typically IVF can be successful in a BMI with IVF can be successful in women with the BMI over 30. Some practices will maybe not do IVF if the BMI is over 40. But I think that's provider and practice dependent. And I think in general, there are IVF is considered a high risk pregnancy state. I mean, different doctors say different things, but in general, I guess it's regarded as a high risk state. And so obesity is also a high risk state. So I think, we're always trying to minimize as many risks as possible. And so with obesity comes the increased risk of, issues with blood pressure, issues with diabetes and blood sugar and things like that. So whatever we can do to kind of minimize those risks, we want to try to do. And then somebody asked how many months did you try before seeing a doctor? And again, like I waited like maybe 6 months, 7 months. But one thing I say to my young ladies, especially my professional ladies who are maybe going to be in school for a while and delayed childbearing, there's no harm in getting a fertility workup and just seeing where you stand. I remember having a young lady who's an OBGYN resident. She was like, I just want to know, I just want to know, do I have some time? She was young, she was in her 20s. I'm like, yeah. Sometimes you just want to know, and it gives you peace. It gives you peace to know, like, I can chill out and not do anything right now. Or it says like, okay, maybe I need to think about freezing my eggs or doing some research or starting to save and all that stuff. So I'm tired, but I hope this episode was helpful for you guys. I hope that it kind of just sheds some light on the whole IVF stuff. Leave me some comments and let me know what you thought. Share this episode with a friend that you have that maybe have questions about IVF or who are going to be going through it too. And maybe you just want to give them as what to look for and what to prepare for. And as always, follow me on Instagram. Let me know if you have any questions, any suggestions, and I'll see you in the next episode.